Good morning to all of you. Now, before we start with our class, before we start with anything, I just want to make sure that all is working okay, that all is working perfectly in class. All right? Now, can any one of you tell me if you can hear my voice loud and clear? Okay, thank you for answering, ZJ. Now, I also want to know if you can see my video clearly and continuously playing without any interruptions. Yes? Okay. All right. Thank you for letting me know, ZJ. So I assume that it is also the same thing with everyone else. That everyone can also hear my voice loudly and clearly and can also see my video continuously playing without it pausing, stopping, or with any interruptions. So good job in using our chat box in answering my questions. Now I also would like you to know that we also have our speak button. Okay, our speak button in class. This is the white microphone icon that you can see in class, and you can use this to also talk to me directly. Say, I do have a question and you want to answer me directly, then you can click on the speak button so you can talk to me without the other students hearing you. Okay? So you can use either our chat box or our speak button. So, if there's any problems in class, if there's any interruptions with our connection, if you think that my voice went from loud to very soft, then you can let me know. Okay? Also, if you do have any questions or any clarifications in our lessons, then please do let me know. There is no way for me to know that there are some parts that are unclear with you if you do not tell it to me. And remember that it is our goal to maximize our learning for each of our class. And of course, our goal is for everyone to understand all of the parts in our lessons from start up until the end. Okay? All right. So, again, good morning, everyone. I'd like to welcome each and every one of you. I see a lot of students joining our class for today. Now, I'd like to greet each and every one of you. Good morning and welcome to class Even, you, Ray, SL, Jason, ZJ, Eugene, Jackie, Leslie, LXF, Shelly, Jane, Sunina, and UUQ. Welcome to you all. Now, I'd like to introduce myself briefly. My name is Angel, like the angel, and you can call me Teacher Angel. Okay, just that. Now, I studied Bachelor of Science in Nursing in Xavier University, and I taught ESL for more than 3 years. Students from my class range from 3 years old to 50 years old. And the courses that I have covered are ESL, Business English, TOEIC, and ESP. Okay. All right. Hello. Good morning, Eugene. Okay. So, again, I'd like to welcome everybody in our course this morning. So, I'd like to introduce you, everyone, to our course, the English for Specific Purposes. Okay, now this covers our ESP course, specifically covers medical and health service provider. Okay, so we know, we all know how we call the different parts of our body, the medical terms, the different sicknesses and medications in our own language, in our native language. But since we all wanted to be globally competitive and also work in an international environment, then we would like to also learn how to use these terms, or how to call these terms in English language. Okay, so that is what we are going to start with for today, this morning. So if you were looking at our first slide, okay, our first slide shows us what we are going to cover for our first lesson today, which is parts of the body. So we start from the very basic in naming and trying to identify each of the body parts, each of our body parts. Like what I've mentioned, we know how we call these parts in our native language, but we should know how to use them or how to call them in English as well. Okay? Since we all wanted to work in an international environment, a globally competitive environment, then we should know how to express ourselves in medical field in English as well. So that is what our course is all about. That is what our course is for. Okay, so at the end of our course, we know that each and every one of you will be very competitive in working in a medical field in an international environment using the English language. All right, so to cover what our objective is for today's class, I do have here plotted in page 2. So at the end of our class, we all would be able to identify and pronounce the different parts of the body in English. Okay, so we would know the different parts, how we call them in English, and how to properly say them in English. Okay, also at the end of our class today, you would be able to tell what these body parts are for, what their use are, what their functions are in English language. Okay, so not just naming them, but also knowing what they are for, what their functions are, okay, what their use are. Okay, next, at the end of our class, we would also be able to name some English sicknesses, sickness terms, okay, of the different parts of our body in English language. So we know how to call these sickness in our native language, but we don't know how we call them in English. And that is what we are going to learn, okay, some of them for this morning in this class. Okay, and last but not the least, at the end of our class, everybody would understand English medication for different body parts associated sicknesses. Okay, so not just identifying parts, naming the different parts of our body, learning how to pronounce these different parts, we would also know their functions, okay, what their use are. Third, we would know what are the different sicknesses on these body parts that can happen or that can occur. And fourth, what to do, okay, medications, first aid, what to do in these sicknesses. So these are all our objective in our class for today, for this morning. And at the end of our class, it is our goal to meet all of these objectives. Everything clear so far? Okay, please do let me know if I do speak too fast, okay? So I can know how to pace, how to work in a slower pace for everybody. So just remember, just let me know if you do have any questions, okay? All right. So now we are going to proceed onto the page 3, onto page 3. So as what we are going to, or the structure of our class today is that since our first objective is to learn the different parts of our body and their pronunciation, then there will be a lot of vocabulary terms. Okay? They may not be a more complicated part yet, since it is our first day, it is our first lesson, then it is going to be more, well, easy or general first, okay? So we're going to have our vocabulary, and in it, we are going to practice as well our pronunciation, okay? We're going to cover some of the uses of these parts, okay? And also, you would be able to see situational challenges in our or throughout our class. Now, situational challenges is important, especially that we are all in the medical field. And we should know what to do in response to these emergency cases. Okay? Or this situational challenges will cover our second or third and fourth objective, which is to familiarize ourselves with the different English sicknesses and the different English medications. Okay? So let us go start on to page 3. So let's start off. So let's start off with our face. Face. Okay? Now the different parts of our face, or the different parts that we can see on our face, we do have our eyes. Eyes. We have our nose. We also have our mouth. We do have our ears. We do have our cheeks. We do have our chin. We do have our nostrils. Next, we have eyebrows. Next, eyelids. That is the part that closes when you sleep. Okay, when you close your eyes, when you open your eyes. Eyelid or eyelids. Okay. Eyelash, that is the hair outside your eye. Eyelash, eyelashes. Okay. Now, I'm pretty sure that the women in here are familiar with eyelash because you cosmetically curl them when you do your makeup. Okay. But for men, okay, they are not useless at all because we do have our eyelash to protect our eyes from foreign objects, okay, from dirt and so forth. Okay, so that is what the hair is for. And then we have our lips. Okay, now these are the different parts of our face. Okay. All right. So, students, I would like for you to um, say the words with me on your end. Okay. If I would like for you to also practice it on your end. I know that I cannot hear you all the time, unless you use our speak button, but I also would like for you to at least practice on your end so you know how it feels when you say it, how it comes, how it sounds like when it comes from your mouth. Okay, you should be able to practice it yourself as well. Okay. Now also, if you wish for me to repeat pronouncing some of the words, then I would like for you to let me know as well. Okay? So do not be shy, please. All right, so let's start off with our situational challenge number 1. Now, I would like for you to imagine that an American patient came to the emergency room with a bloody nose. Now, as a nurse, what are you going to do? Is it A, tourniquet? B, raise the patient's head and use cotton swab? Or is it C, both? As a nurse, what do you think is the best thing to do? Good answer, Ray. What about the others? Okay. UUQ chose letter B as well. And the correct answer is indeed letter B. Okay. We use tourniquet. For the nurses here, can you tell me why shouldn't we be using tourniquet immediately? Why not A? Okay, why not A? Okay, so I'm not sure if you've seen a tourniquet before, or maybe that is true, Leslie. I do agree with you because we don't know if there's a cut. Okay, we don't know if there's excess bleeding due to an open wound. Okay, in times like a patient would have a bloody nose, normally it is just because of too much heat, a sudden change of temperature, okay, a sudden change of altitude, okay, when you maybe when you go fly, or when you go diving, okay, so sudden change of altitude, temperature, too much heat. So these are the causes of a bloody nose, of your nose bleeding, but it doesn't necessarily mean that you do have an open wound. And a tourniquet normally is applicable for, okay, a life-threatening state wherein there's continuous bleeding, because you use it to stop the bleeding. Okay? So the correct answer is indeed letter B. So you have to raise the patient's head and use cotton swab to remove the blood. I do have a question. Why should we raise the patient's head? Any idea? Why should we raise the patient's head? Okay, it is important that the part that is bleeding should be above your head or above the level of your heart. Okay, because that will lessen the bleeding if it's above your heart, the level of your heart. So you should you should raise your patient's head and use a cotton swab to clear the nostrils. Because if there's too much blood and if it dried up, that might cause clogged nostrils, and then your patient wouldn't be able to breathe. So, the correct answer is letter B. Now let's move on to page 4. Let's read all together. Nose. One more time. Nose. Now, we use our nose to smell things. We smell things using our nose. Also, we breathe through our nose. Okay? Now, situational challenge number 2. A younger student asks you, what will happen if you hold your breath or you stopped breathing for a minute? Just a minute, okay? What is the effect? What do you think is the immediate reaction of your body? Is it A, panic attack, B, heart palpitation, or is it C, pass out? What do you think is the correct answer? Okay, so I see an answer from UUQC. I see Ray and Eugene's answer, letter B. Okay. All right, so the correct answer here is letter B, heart palpitation. So, letter C would be okay, would be correct if you've stopped breathing for maybe more than 3 or 5 minutes, then you would pass out. There'll be no enough oxygen in your body. Okay? But if it's just a minute, okay, your body would recognize that there is something wrong, and it will fasten, or it will pump faster. As for your heart, it will try to keep up with the lost oxygen. Okay, the cycle that you try to stop, okay, it will try to keep up with that. So the correct answer is letter B, heart palpitation. Now let's move on. Page 5. Let's read together. Arm and hand. Let's read the different parts. We do have finger, palm, wrist, forearm, elbow, upper arm, shoulder, thumb. Now let's continue on with the hand and fingers. Hand, hands, thumb, index finger, middle finger, ring finger, little finger, or sometimes people call it pinky finger. And then we have our nails. Okay? Now, for situational challenge number 3, what would be your initial reaction when you see a patient with a broken arm? What would be your initial action? Is it A, do a tourniquet, B, assess this condition, or C, apply bandage? Again, what would be your initial action? Okay, I got Ray's answer, letter B. What about the others? Leslie says B. Any other answers? And I do agree with all of your answers. It is letter B. You have to assess the condition or the situation first. So you see a broken arm. Now, if that is the case, then you might as well wait for a professional that could help you out. You can't just move the person because that might cause more issues onto the person. Also, you might as well want to identify whether there's an open wound or just the blood, or sorry, just the bone, the bone being broken, but not really like an open wound. So that could be different if you see an open wound wherein you need to stop the bleeding. Then you have to do a tourniquet then, right? Okay. So that is correct, everyone. Assess the condition first. Let's move on. Page 6. Let's read the vocabulary together. The leg and foot. Now let's read the parts. Knee, leg, shin, calf, muscle, ankle, heel, foot, and toe. Okay? Now, the ankle. Does any one of you know what ankle, which part of your foot is the ankle? Now, this is the joint between your leg and your foot. It actually is located on top of your heel. Okay? Ankle. Now, for our situational challenge number 4, there are jobs or professions wherein people are susceptible to having foot and leg injuries. Now, in your opinion, which profession do people have the most leg and foot related injuries? Is it A, teacher, B, dancer, or C, policeman? Which profession have the most leg and foot related injuries? Okay. Now I see 4 answers. ZJ, Leslie, Ray, UUQ, and Even says B. And that is correct, you all. It is in fact letter B. Okay. Now a policeman can also acquire foot or leg injuries, but only at times when they have to catch a criminal, okay, do stunts or whatever. But in a regular basis, we are talking about the people who were most susceptible to these injuries, and these are the dancers, because they use their foot, they use their feet, legs each and every time they dance. Okay, now let's continue on. Page 7. So we're now going to move on to internal parts of the body. Let's read together. The first one, heart. Now our heart, it pumps blood around your body. Okay? This is like the generator that makes everything going. It is our heart. Next, lungs. When you breathe, the air goes into your lungs, then is circulated throughout your body. Okay? Oxygen. Now, so for our situational challenge number 5, let's imagine that you were in London and suddenly a cardiac arrest is happening. What is the first step you need to do to help the individual? Say you were a first aid responder. Okay? What are you going to do? A, CPR, B, air ventilation, C, give drugs, or is it D, give water to drink? Okay, I see 3 answers from Ray, UUQ, and Sunina, which all shows letter A. Okay, Mandy says A as well. And the correct answer is indeed letter A. Thank you, everyone, for answering. Yes, it is A. So, first, for a cardiac arrest, it is best to do CPR. But make sure that you were trained to do it, okay? Not just you having watched it in movies or something, make sure that you were trained, you were certified to do first aid as well. Okay, let's move on. Page 8. Let's read vocabularies. Veins. Now, these transport blood throughout your body. They are like little tubes. Now, when our medical technicians would draw some blood from us for tests, now they try to find our vein, okay, and get blood through it. Now, if you also look at your wrist, these are the blue-green strips that you see in it. Okay, like under your skin, these are your veins. And you see a lot of veins throughout your body. Because again, these transport blood, oxygen throughout our bodies. Okay, next, brain. Now, this is your thinking machine that is located inside your head. Next, we do have throat. Now, the food goes down this and get to your stomach for processing, or for the digesting part. Now, just a little trivia for everyone. Do you know that your brain generates 12 to 25 watts of electricity? Now, you know that that is enough to power a low wattage LED light. Can you believe that? It's amazing, right? Okay, it looks like as if it's just made out of muscles, but then it can generate electricity on its own, and that makes it very amazing. Okay, let's move on. Page 9. Let's read the liver, the organ that cleans your blood. Next, the stomach. Food goes here when you swallow it, preparing for the digestion part. Next, kidneys. Now, these are the organs that process all your body waste. Now, for our situational challenge number 6, a patient is having pain on urination. Now, what else are the symptoms of kidney stones? Is it A, blood in urine, B, discoloration, C, bloating, or D, MRI? Okay, anyone? Okay, right, so I see a lot of you answered letter A, blood in urine, and that is the correct answer. So if you do have kidney stones, these are, I'd say, a step higher compared to just like the normal UTI or something. Okay, so you would be experiencing blood in your urine. Okay, let's move on. Page 10. The skeleton. Now, skeleton, all of the bones in your body. There are a lot of bones in one's body, and that is what we call our skeleton. Okay? Next, ribs. Now, these are the bones that protect the organs in your chest. That is the hard part in our chest. Okay? So, ribs, that is like a cage. Okay? A cage where it protects your heart and your lungs and other parts as well. So that's ribs. Now, for our situational challenge number 7, okay, I would hang on. I'd like to know what you are going to do if a person is suffering from bone atrophy. What would be the initial medical advice? Now, I would like for you to give 3 pieces of advice. Okay, so is it A, give milk, B, bone density analysis, C, give cheese, D, more eggs? Okay? So atrophy, when we say atrophy, it is the degeneration, the decline of use. Okay? So there should be three answers, three letters. So when we talk about bone atrophy, meaning your bone is gradually declining. It's degenerating. Okay? All right. So I see a lot of you who've answered the correct one. These are A, give milk, yes. B, bone density analysis, and C, give cheese. That is correct. Okay? So everything clear so far? Let's move on. Page 11. Okay? So let's read all together. The bones. Now your skeleton consists of many bones. There are about 206 bones in one's body. Okay? So imagine that, like 206 bones. That is a lot. Next, we do have skin. Now this covers almost the entire body and helps keep all the organs and muscles in place. So if you're going to do like a simple analyzation, it covers all parts of our body. It keeps everything inside and all together, right? Skin. Okay? Now for our situational challenge number 8, let's all imagine that a famous New York fashion model arrives at the hospital and asks you for medical advice about fungal infection. Now what are you going to say? Is it A, give an ointment, B, take a bath, C, treat with fungicide, or D, take medicine? So from this sickness itself, fungal infection, what do you think would be the best solution for it? Okay. Now I see UUQ says letter C. Okay, letter C. And you know what? The correct answer here is letter C. That is correct. Because of the word fungicide. Fungicide is specifically used for fungal infection. That is correct. You can't just wash it with soap and water because that won't remove it. Okay? So, there goes. Treat with fungicide. Now let's move on. Page 12. So we are going to talk about levels of organization. Now we all know that our body consists of so many parts, so many organs. Okay? Now let's start off with the most basic and the most simple part of our body, which all of these organs started from, which is a cell or cells. Now these cells, when they work together, they form tissues. Now from tissues, if these work together, they form an organ. Okay? Now organs work together to form an organ system. Okay? And there are about 10 organ systems in a human body. Okay? So let us read these organ systems in our body one by one. Can you see it clearly? Okay. So let's read them one by one. I want you to let me know if you wish for me to repeat it again. Okay, to say it again, to practice your pronunciation. Okay? Alright, let's continue on. A, cardiovascular. Cardiovascular. Second, digestive or excretory. Third, endocrine. Fourth, integumentary or exocrine. Next, lymphatic, immune system. Next, muscular, skeletal. Next, nervous system. Next, renal, urinary system. Next, reproduce. And last, we do have respiratory system. Now these are the main organ systems in our body. So I know that sounds a lot, but miraculously, everything can be found inside one's body. I remember when I was little, maybe when I was in elementary, when we started studying about the different organ systems, it really got me worried and confused. It really got me confused on how all these organ systems can fit in my tiny body. That was really my concern back then. But at least upon growing up, I understood everything better. So these are the organ systems, and we are going to go through them one by one. So first, we do have our cardiovascular system. So the cardiovascular system permits blood to circulate and transport nutrients, oxygen, carbon dioxide, hormones, and blood cells. And blood cells to inform the cells in the body to provide nourishment. So again, it is connected where the veins are and so forth. So transporting, blood, nutrients, carbon dioxide, hormones, and blood cells. Now, for our situational challenge 10, what would you do? If a person is suffering from a heart stroke. Is it A, sweating, B, shortness of breath, C, seizure, D, salivating? I see Ray's answer, letter B, shortness of breath. Excuse me, I see UUQ's answer, B, shortness of breath as well. Salivating can be too much, right? Seizure can be maybe possible but a more worse scenario. But the correct answer is, first sign that someone is suffering from heart stroke is that they have shortness of breath. That is true. Now page 14. Let's talk about the digestive system. Now the digestive system is where we process or we digest our food. Now this digestive system, it breaks down the food you eat into nutrients for your body. So the food that you eat, I would like for you to hang on. So digestive system. So there. It needs to be digested, for the nutrients to be brought throughout our body. So that is what our digestive system is for. Now, for our situational challenge number 10, let us imagine that your cousin from America calls you in the telephone and says he thinks he is suffering from food poisoning. How are you going to help him? What are you going to tell him? Is it A, to tell him to drink milk, B, go to the nearest hospital, or is it C, call 911? What do you think would be the best route? And it is, thank you so much for answering, Ray. That is correct. Letter C. Okay, call 911. Okay, it is letter C. Next, excretory system. Okay, now this is the part where it releases of wastes and regular bodily fluids. System that removes excess unnecessary material from the body fluids or an organism and prevent damage to the body. Okay, endocrine system. It regulates body functions by sending chemical messages. Okay, now for our situational challenge number 11, what are you going to do if a patient is sweating excessively, and what do you think is the medical condition? Is it A, diabetes, B, heart stroke, or is it D, headache? Okay. Hang on. Okay, so I do have here UUQ's answer, letter B, headache. Headache, Ray, is that your answer? Okay. For students who answered B, heart stroke, that is correct. Okay. Now let's move on. Page 16. Integumentary or exocrine system. Now this system protects the body from various kinds of damage, such as water loss or abrasion from outside. This system comprises of skin, hair, and nails. Now our lymphatic or immune system, it hosts defense system comprising many biological structures and processes within an organism that protects against disease. Okay, so lymphatic immune system, we can zoom in to our okay, hang on. Okay, there you go. So different organs in an immune system. Okay. All right. So you can see all of that in here. Tonsils and adenoids, thymus, lymph nodes, where we can see like all throughout our body, appendix, bone marrow, lymph nodes, again, lymphatic vessels, spleen, Peyer's patches, and some more lymph nodes and vessels. Now bone marrow, it is the soft tissue in the hollow center of bones. It is the ultimate source of all blood cells, including the immune cells. Okay, next, skeletal or muscular system. Now these are organ systems that consist of skeletal, smooth, and cardiac muscles. Now it permits movement of the body, maintains posture, and circulate blood throughout the body. So it is really important that you take care of your skeletal and muscle organs, okay, systems. Just so when you reached the golden age, you wouldn't be walking very difficult because you've had your bones like not, you're always trying to make them healthy, so that is good. Okay, now just a little trivia for everyone. Professional athlete and sport-minded people are the most susceptible to suffer from cramps. Okay, so that is true. Now let's move on, page 18. So some more parts of our body. We do have the renal or the urinary system. Okay, so the purpose of the renal system is to eliminate wastes from the body. It regulates blood volume and blood pressure, control levels of electrolytes and metabolites, and regulate blood pH. Okay, so everything will, as you already have noticed, every part already has its contribution. Okay, next, reproductive system. Now this is the genital system and is a system of sex organs within an organism which work together for the purpose of sexual reproduction. Okay, and last, okay, is it the last? Hang on. No, not really last, but we do have respiratory system. Now this consists of specific organs or structures used for process of respiration in an organism or breathing. Okay, respiratory system used for breathing. And next we do have nervous system. So the nervous system is quite important, it is important is because it receives and sends electrical messages throughout the body. The nervous system is the telephone and electrical signaling system of the body. Okay, now let us, if you can try to look out for me. Okay, hang on. Not that. Oh, let's do this, the situational challenge number 12 first. Okay, so let us imagine that an American basketball player was rushed to the hospital due to back injury. What are you going to do? Is it A, MRI, B, a tourniquet, C, an X-ray? Remember that it is the whole back. Okay, so it's the whole back injury, not just an arm or part of your leg. So which do you think it would be the best route? What the best thing to do? Okay, so well, yeah, I do agree with all of your answers. We can answer letter C and letter A. Okay, definitely not a tourniquet, but A and C. Okay, well, as I've noticed, they would people would automatically request for an X-ray, but for a more accurate type of test, then we do MRI. Okay, all right, so that is that covers, or that sums up the 10 different organ systems in our body. Okay, we also discussed about the different parts of the face, different parts of the body, probably the most basic one, but do not fret, because I know that there'll be more learning as we go along our course. Okay, now I'd like to open up our discussion time this time. Now you can use either our chat box or our speak button for you to relay to me what our or yeah, your thoughts or explanation about the entire outing and or the entire what do you call this, discussion of our ESP lesson first. Okay, all right, so we have met indeed our objectives for this class. We've studied the different parts of the body. Okay, any questions about the different parts of the body that we've covered, or if there's any part that you think you're a little unsure about the pronunciation? Was there any words? Because we will definitely go back to it and practice it further if you do. Okay? So good thing that we were able to now identify the different parts of the body, right? Okay. Second, of course, we were able to identify their different functions or uses. Okay? Functions or uses. And then third, we also discussed about the different sicknesses. Okay? On our situational challenges, you were listening closely to them, and in which we've discussed the different sickness one person can have or can experience. Okay, there you go. And last but not the least, we covered our objective to learn about what? Any idea? The medications and also the first aid on what you are going to do in these specific situations. Okay? All right. So, I think that's about it for this morning. Okay? Now, I'd like to know first, do you have any questions or clarifications? Anyone? Any clarifications, questions, any part that isn't clear? Okay, if none, then I would like to thank every one of you. I'd like to express my gratitude in you joining our class for this morning. I'd like to thank each and every one of you for participating in our discussion, for answering my questions. Okay, I sure hope to see you on our next class. And again, thank you everyone, and have a good day. Enjoy the rest of the day, everyone. Take care. Bye.